doing it.
No, thank you. Thank you. Introduce everybody.
Are you guys ready? All right. Okay, so we've got here, of course, Mayor Whitmire, Dr. Peter Hotez, who is the Texas Children's Hospital Director of Vaccine Development, Dr. Erica Brown, Division Director of Community Health and Wellness and Local Health Authority at Harris County Public Health, and we have also here, who else am I missing? It says here Jennifer. Dr. Tamisha Jones, Interim Chief Medical Officer at Legacy Center. Thank you. Dr. Stephen Brass, Executive Vice President and System Chief Medical Executive at Harris Health. Dr. Perth, of course, the Local Health Authority for Houston. Mr. Stephen Williams, Director at Houston Health Department. And Jennifer Kiger, who is our head of epidemiology at Harris County Public Health, Dr. Singh, Chief Medical Officer at Texas Children's Hospital. And there are other folks. Leah Barton here is the director of our Harris County Public Health Department. So some of us are going to speak, and then everyone's available for questions. And we really have a wealth of information here. So thank you all. Thank you, Mayor, for your partnership, for being here. And let me get started. So we've all heard about the measles outbreak in West Texas. And if you talk to any of these doctors, you'll see that up until recently, a lot of doctors had never encountered measles. Certainly those that have been practicing most recently, it was something that a lot of us had barely heard about. Prior to the 1960s, 1980s, around 1 in 4 people with measles used to end up hospitalized. Now, most of us were vaccinated when we were children, and that's why we don't hear about measles. Measles was very, very contagious, and so I said the rate of folks that were hospitalized, each person with measles used to be able to infect 18 other people. So to put that into context, a person with COVID used to infect on average 3 other people. So just imagine what it was like before there were vaccines with a virus that was so contagious, and the fact that we really don't hear about it, don't deal with it. That's because of the vaccination efforts that took place after this, around the 60s and for a couple decades after that. So what is measles? And folks here will explain what are the symptoms that people need to look for and to go to their primary care physician. But it's a very contagious respiratory disease. So if somebody coughs or sneezes in a public setting, the virus itself lingers. The virus remains alive for up to 2 hours, and that makes it particularly infectious for up to 2 hours. That might just sound, okay, respiratory issue. Could it be like a bad cold or the flu? Why should we be worried? But it can lead to people, 1 in 4, get sick enough that they need hospital care, and there can be very, very serious complications that the doctors can explain as well. So what's happening now? On January 23rd, we learned about 2 cases of measles in Gaines County in West Texas. In just 1 month, cases jumped from 2 to 168 cases across 9 counties in Texas and 1 county in New Mexico. So I want to be clear about how significant this outbreak is in West Texas. It is not normal to have an outbreak like that. This is not something that we see in the United States, something we have not seen in decades. And so in past instances of cases in the United States, we may have 100 or a couple hundred, but they'll be spread out. It's not an outbreak where that virus is spreading from community member to community member. It'll be isolated people who have come back from traveling, who maybe were not vaccinated and have brought the virus, but that virus doesn't spread because those around them are vaccinated. So it's good news that the cases are still in the surrounding region of Gaines County, the neighboring areas of New Mexico, but of course we can be pretty much sure that eventually the virus is going to reach Harris County. We already had 2 cases in January, and so we have to be prepared. The data shows us the vast majority of the people who have contracted the virus in this outbreak were either not vaccinated or of unknown vaccination status. So that tells you the good news, which is we have a way to fight against this virus. We're very fortunate there are currently no active cases in Harris County, and that measles is a completely preventable disease. We can prevent this from becoming any kind of emergency here in Harris County if we're proactive and make sure everybody's vaccinated. We do have a very high vaccination rate, but we want to, if it's around 94%, we don't want it to get lower than that. We certainly want it to get higher so that makes sure we absolutely have that herd immunity that we need. Now, let me just be very clear about this, and I'll close my remarks soon. When we hear outbreak, we might think of COVID. We all have that trauma, okay? We all lived through that, and we're strong to be here. But this is not COVID, okay? This is not that. COVID was so dangerous because it was a new virus. It was a new virus. We hadn't seen it before. We didn't have a vaccine, if you'll recall, for a good year. Measles is not new. We've had a vaccine for decades. However, unlike COVID, measles, again, is a lot more contagious, and also there is not a treatment in the sense that, you know, with COVID, we now have Paxlovid. With measles, once you get it, you can only treat the symptoms. So at this point, there's no reason to worry. The call to action is we need to get vaccinated and just take that additional step if our kids are not vaccinated or if we ourselves are not. So we're hosting a weekend of action this coming weekend, and all of us here are really pushing for that. Harris County, City of Houston, we're working with the community, with Legacy Public Health, Texas Children's Hospital, and doing that push for vaccines. We have also talked to our healthcare providers around the county to make sure that they're vigilant in recognizing measles symptoms and following proper protocols. There are mobile immunization trucks that Children's Hospital here will talk about in a little bit, so that we can get vaccines in areas with lower vaccination rates. If you were born in the U.S. after 1968, you probably have the measles vaccine. I mean, really, around the world, most countries, this is under control. But if you're not sure, just check with your provider. They can test to see whether you had the vaccine. You may want to get a booster. And then, of course, for children, any child over 12 months of age should be getting the vaccine. So they should get the first dose after 12 months and the second dose between ages 4 and 6. So there's a way for you guys to get appointments. If you have a primary care physician, please go to them for the vaccine. If you feel symptomatic, please go to your physician to check out those symptoms. Don't go to an ER, an urgent care that might be crowded, again, because of how contagious the virus is. And if you don't have health insurance, don't have a primary care physician, your child doesn't have health insurance, for whatever reason you don't feel comfortable going to the hospital, visit readyharris.org. Our Harris County Public Health Department, Houston Health Department, and other organizations like Legacy will offer vaccines free of charge for those. So readyharris.org, we have a map and we have information on the resources, and we're working on a call center. So let me pass it on here to the mayor. I'll repeat my remarks in Spanish after that, but I want to make sure folks know this is completely in our hands. We have no active cases right now. We've got the rodeo coming up. We already have to worry about floods and hurricanes and derechos, it turns out, so let's not worry about measles as well. Let's just enjoy our times and make sure we get those 12-month-olds vaccinated, and those, if there's any of you who are not vaccinated, that you get that done. Mayor.
Thank you, Judge, and thank you for your leadership and the collaboration, because we know a virus does not respect county lines, city limits. Definitely, we're all in this together. The remedy for everything we're talking about today, the judges has articulated our concerns. The remedy is being vaccinated. And if you have any doubt under your circumstances of have you been vaccinated, take the precaution of being vaccinated. The City of Houston is aware of the circumstances. We've reached out to all of our stakeholders. The Health Department last weekend provided an outreach program. We're discussing it daily, and we believe that if everyone will get vaccinated, anyone that can hear my voice, make certain you're vaccinated. Make sure your family members, and you will be protected from this virus. I want to, with the judge's consent, yield to my health director, who is monitoring this with our health department around the clock. We're very fortunate in the City of Houston, no detection of an infected resident. That's very important to emphasize. At this time, no one inside the City of Houston has been detected. The West Texas incidents, primarily from travel and lack of individuals being vaccinated. That's not the case here in Houston, and certainly the judge speaking for Harris County and our region. So let me yield to Steve Williams, the Director of Health, who he and his staff, all hands on deck. We're communicating. Go to your primary care provider. If you do not have one, talk to the City of Houston, and we will give you that outreach capability. Steve, would you please give us a status report?
Thank you, Mayor. My focus is primarily going to be on what we're doing from the Houston Health Department's perspective. We're primarily focused on prevention. We've been participating in weekly calls with our regional and state partners. You might also know that we're testing for measles through our Wastewater Surveillance Center of Excellence. We currently monitor 36 wastewater treatment facilities and 48 manholes for measles. We're going to start monitoring schools with low vaccination rates, several shelters, nursing homes, and 2 jails for measles. In January, measles was found in a wastewater sample that came from a wastewater treatment plant serving the area where 2 confirmed travel-related measles cases were found. And in response to that, we notified impacted groups. We put out a health advisory. We interviewed people that had a level of exposure, provided education, and quite frankly, thankfully, there were no cases that resulted from those initial cases. In response to this situation in West Texas, we've provided measles education to more than 500 medical providers in a town hall just last Friday. We also held a measles vaccination clinic over the past weekend. We're really updating our employees on measles so that we can have a common message when we're talking to people. We're also working with local providers, Texas Vaccine for Children providers, our adult safety net providers, asking whether or not they're actually open for walk-ins, whether or not they're willing to reduce their fees and accepting new patients. Part of this is to increase access to vaccination, because government, quite frankly, can't really do it all. We need to be in partnership with all of our medical providers. But maybe more importantly, we're really focusing our outreach efforts on schools and various independent school districts with low vaccination rates and daycare facilities. We actually know where the low vaccination rates are, and so we're targeting them. We've notified local hospitals and provided applicable communication and health education. All of our information and messaging will be available in multiple languages. If you're a provider and would like more information or to be included in our next town hall, we ask that you call 832-393-5188. Or for the general public, if you have questions, just give us a call at our call center at 832-393-5427, or visit our website at houstonhealth.org. This site will be updated regularly and will have useful information like finding a provider, guidance on vaccines, signs, and symptoms.
Thank you. And let me call up our local health authority, Dr. Brown.
Thank you, everyone. Good afternoon. So in partnership with Houston, we too want to make sure that the vaccine is accessible to all. You can reach out to us through our website, and also we'll be out on readyharris.org. But it is imperative that those who are able to get vaccinated do so, because the disease is completely preventable through vaccination. I do want to take a moment to go over some of the signs and symptoms, just in case someone may think that they've been exposed. So high fever is one of the cardinal symptoms. A rash that starts from the face or neck and works its way down, that feels more like a sandpaper rash and looks like a blotchy red rash. Conjunctivitis, which is tearing of the eyes and redness of the eyes, a runny nose, and perhaps some spots in the back of the throat may be symptoms as well. So again, we want to encourage everyone to get vaccinated, but we also want to advise the public on what to be mindful to watch out for if you think you have been exposed. And now I'm going to turn it over to Dr. Hotez.
Well, thank you very much. I'm thrilled to be here. I wish it wasn't under these circumstances. Actually, the judge and the mayor got most of my talking points, so when next time CNN or MSNBC calls, I'm just going to refer them to you, and you can just do that. We did a great summary. A few things to think about. This is a very dangerous measles epidemic in West Texas. The numbers continue to climb. Every few days there's an update, and every time the numbers go up. The reason that's significant is because measles has what's called an incubation period of around 12 days, meaning from the time you're infected with the virus to the time you show symptoms is on average 12 days. It can go as long as 21 days. So every time you see the numbers going up from the state health department, it's evergreen. It means we're going to still be in this for at least another 2 weeks. And the fact that this is continuing to accelerate suggests to me that it's going to be around for quite some time. I don't see this going down anytime soon in West Texas. The good news is we do have an outstanding vaccine. I develop vaccines for a living, and when we talk about making the ideal vaccine for this disease or that, our paradigm is measles. We say our goal is, our aspirational goal is to make a vaccine that's as good as the MMR vaccine, because a single dose is 90% protective, and 2 doses is 97% protective. You're not going to get any better than that, and an incredibly safe vaccine, one of the best safety profiles of any vaccine we have. So it's important to get that word out. The other aspect of the vaccine is not only its protective effect against measles, but it's called MMR for a reason, because it also protects against mumps, and mumps is a leading cause of orchitis, testicular swelling in boys and males that could lead to sterility. That's yet another reason to get the MMR vaccine. And the R is rubella, which causes German measles, but the one you worry about the most is called congenital rubella syndrome. If a pregnant woman is unfortunate enough to get rubella, their child could be born with profound birth defects, including heart defects, deafness, intellectual disabilities. I've seen only a handful of congenital rubella cases and blindness. I've seen only from cataracts. I've seen only a handful of congenital rubella cases in my time, and you never forget them when you see them. So that is the message. I know we sound a bit like a broken record, but the best vaccine you can possibly imagine, an incredible safety profile, and that's the message, especially if you're going into crowded areas in the city where potentially there could have individuals shedding measles virus into the atmosphere. So thank you.
Okay, thank you, Dr. Hotez. We'll hear from Dr. Purse now.
Thank you, Judge. As Dr. Hotez pointed out, a lot of the biggest points have been already said. When we talk about measles, I think of it in, there's bad news, there's good news. You've heard a lot of the bad news. It is extremely contagious. It's very easy to spread from person to person, especially somebody who's unvaccinated. And when you become ill with it, we know, the judge pointed out, up to 20% of people who are ill are going to get sick enough that they require hospitalization. Well, the other 80% are going to still be really sick, high fever, body aches, feeling miserable, in bed. It is a miserable illness to get through. Most people do fine, but yeah, about 1 in 1,000 people are going to die, and there are some people who are going to have permanent neurological problems because it can affect the brain. So the bad news about measles is that it is very contagious, and it can make you really sick and have some horrible consequences. The good news about measles is number one, and the judge mentioned this and others have mentioned, is that we've got pretty decent vaccine coverage, as evidenced by the fact that when we had the 2 cases here back in December, January, it didn't spread. It didn't spread for basically 3 reasons, and I want to reinforce these 3 reasons. One is that people who got sick, they got pretty sick. They sought help. They raised their hand. They went to their doctor. The doctor then made the diagnosis, which today is to be commended because so many physicians have not seen measles because it hasn't really been common for over 50 years. So the doctors were on the ball. They made the diagnosis. And then the third thing is that the people who were infected, they cooperated with the doctors and the health department, and they kept themselves at home so that it didn't spread. And so as we look forward and people worry about, might I get measles? Well, if you're worried about maybe getting measles, you need to get yourself vaccinated. If you know that you were never vaccinated, for example, you were born in some country, a foreign country where vaccination wasn't common, and you came here at the age of whatever, and now it's a couple years later, and you know that you weren't vaccinated, you can get vaccinated as an adult. There's plenty of vaccine available. We've already talked about ways that you can vaccinate it. If you're not sure, you don't know, you think maybe, but you don't have your vaccination records because that was a long time ago, that's fine. You can still get vaccinated. Even if you were vaccinated as a child, you get vaccinated again, it's not going to hurt you. So that would be the other thing. And then if for some reason you want to know if you're vaccinated, there is a blood test, but quite honestly, that takes several days. It's a little bit more expensive. It's probably easier to just go ahead and get vaccinated again. And then the other thing that I want to point out is that in our defense system, and Director Williams pointed out the wastewater surveillance, our wastewater surveillance tells us right now there's no measles in Houston. As of this last week, there's no measles, none. And we're really confident because when we had 2 cases out of 2.5 million people, we picked it up. That is an extremely sensitive way to detect if there's measles. So right now is not the time for anybody to get overly excited. It is not the time for anybody to get scared. It is the time to get smart, consider your situation, and if you need to get vaccinated, get vaccinated. If you have a family member that you're particularly worried about, they've got a chronic illness, they've got an immune system problem, they're vulnerable for whatever reason, remember, when you're ill with the virus, the person you're most likely to spread it to is a family member. So if you have a family member that you're worried about, your best line of defense is for everyone in the family to make sure you're vaccinated, because that's who's most likely to spread it to the person you're most worried about, okay? So that's all I have. Thank you.
I'd like to clear, because you were talking about December, and I was saying there are no active cases.
Right.
So that's what we're speaking to. Today, there's been no
there's not, right.
active cases detected in Houston, Texas.
That's right. That's right. And our wastewater is clean. There is, well, our wastewater is actually dirty, but our wastewater, our wastewater is wastewater. But there's no measles virus, and there hasn't been since back December, January.
Who were travelers.
And they had traveled. That was a travel case, right? They had traveled internationally, caught it, and came back with it.
Okay, so let me repeat my remarks in Spanish, and in the meantime, I'm going to ask the other folks who are here if there's anything that we did not mention to please, come up after my Spanish remarks, and then we're going to take questions. One thing I want to make sure somebody talks about is about the babies, because you can only vaccinate children over 12 months old. So what happens if you have a baby that's younger than that? So I'll let one of the doctors talk about that. But let me just repeat briefly en Spanish. Primero quiero agradecerle al alcalde Whitmire, a todos los doctores y profesionales que están aquí, tanto de la ciudad, del condado y también hospitales y organizaciones en nuestra comunidad. Estamos trabajando todos juntos en este tema del sarampión. Muchos de estos doctores, los doctores en la comunidad, nunca habían tenido que manejar el sarampión. ¿Por qué? Porque en los años 60 empezó una campaña de vacunación y hoy día y desde hace ya varias décadas el sarampión prácticamente que no existe en este país, inclusive en muchos países alrededor del mundo. Si usted recuerda, de niños, muchos de nosotros nos pusimos la vacuna MMR, la vacuna contra el sarampión y la rubiola y también las paperas, sarampión, rubiola es la MMR. Esa vacuna es increíblemente efectiva, es una vacuna ideal, explican los expertos, pero ahora estamos viendo en el oeste de Texas un brote de sarampión. ¿Han habido casos de sarampión en los últimos años, últimas décadas? Sí. pero de repente hay docenas, de repente 100 casos, pero son casos no relacionados. Individuos que han viajado a un país donde no esté bajo control el sarampión, que no se han vacunado, llegan regresan a Estados Unidos y tienen sarampión, pero no contagian a nadie más, porque tantos de nosotros, la gran mayoría, 94% de nosotros, estamos vacunados. Pero ¿qué está sucediendo ahorita en el oeste de Texas, en el área, en el área alrededor también de Nuevo México? Hay 9 condados en Texas, un condado en el estado de Nuevo México, donde ya se ha esparcido el virus con tal rapidez y a tal nivel que es muy preocupante. Entonces, el 23 de enero se identificaron 2 casos de rubiola, sarampión en el condado de Gaines. En un mes, solo un mes, los casos se incrementaron a 168. Eso es el número de casos que tenemos en este momento. Y lo que hemos aprendido es que la gran mayoría de las personas con sarampión en este momento, en esa área donde hay ese contagio, son personas que no estaban vacunadas o que es incierto si estaban vacunadas. Aquí en el condado Harris no hay ningún caso activo, pero sí llegaron 2 casos hace un par de meses. Habían 2 personas que habían viajado y viajaron y llegaron aquí con sarampión. Pero nuevamente, no se esparció el sarampión gracias al nivel de vacunación de la comunidad. Lo más seguro es que vuelva a llegar el sarampión. Con tanta gente que está infectada, tantos eventos que tenemos aquí, es casi que asegurado. Entonces tenemos que protegernos y asegurarnos que tanto nosotros como nuestros niños y como los bebés están vacunados. Es una enfermedad problemática, peligrosa. 1 de cada 4 o cada 5 personas que se infectan terminan hospitalizadas. Es muy contagiosa. Imagínense, el sarampión contagia, cada persona con sarampión contagia alrededor de 18 personas. Comparando con el COVID, cada persona con COVID contagia alrededor de 3 personas. ¿Por qué? Porque el sarampión permanece en la atmósfera, permanece vivo alrededor de 2 horas. Entonces, si estamos aquí, digamos que yo tuve el sarampión, estornudo, nos vamos, y usted llega en 2 horas, lo puede contraer. Entonces, es por eso que la protección es la vacuna. Entonces, si usted no sabe si está vacunado, siga adelante y vacúnese. Si sabe que tuvo la primera dosis, no ha tenido la segunda, también contacte a su doctor de familia. Si empieza a sentir los síntomas, que es los síntomas normales de un resfrío, pero también con un brote, también de repente con unas marcas en la parte de atrás de la boca. Si empieza a sentir algo de eso, esa fiebre, esos ojos llorosos, vaya a su doctor individual, intente no ir a una sala de emergencias ni un sitio congestionado, porque nuevamente es muy contagioso el virus. Y si usted no tiene doctor de familia, si usted no tiene seguro médico o su niño no tiene seguro médico, venga a que nosotros lo vacunemos, tanto el Departamento de Salud de la ciudad como el Departamento de Salud del Condado Harris y otras organizaciones sin ánimo de lucro. Ofrecemos vacunas sin costo alguno a tanto adultos como a niños. Puede encontrar la información en readyharris.org. Entonces, en conclusión, es la hora del rodeo. Es hora, ya casi viene el spring break, es hora de disfrutar. Tenemos aquí en Condado Harris huracanes, tenemos inundaciones, tornados, el tal derecho. No le sumemos ahora sarampión. Entonces, a vacunarnos los que faltamos y bueno, también inviten a sus familiares y amigos a que hagan lo mismo. Okay, so let me give an opportunity to speak. Are these folks that are going to speak? Okay, so Dr. Singh with Dr. Sapna Singh with Texas Children's Pediatrics. She's the Chief Medical Officer. And so she will speak, and then we'll have Dr. Tamisha Jones, Interim Chief Medical Officer at the Legacy Center. So let's hear from Dr. Singh.
Thank you. You know, as a mom and a pediatrician, all anyone's been speaking to me about for the last few days, I'd probably say even last few weeks, has been measles and measles infection. And that makes sense considering the person that you should be speaking to if you have concerns is your pediatrician or physician. I understand the anxiety and I understand the concerns that are out there. And I'm here to give you good news. I'm here to give you great news, actually. So one of the things I want you to be reassured about is if you've had 2 doses of the measles vaccine, you are 97% immune. That's great news. You're protected. If you've had even 1 dose, you're at 93% immunity. And so for your family, your child, that's still really good news. Now, what if you're not vaccinated or you're not sure if you're vaccinated? Still have really good news, and we are here to help. As part of the call to action, Texas Children's Pediatrics, through our clinics, as well as our mobile health clinics, is going to be helping to get you those vaccinations. Including this weekend, so starting this Saturday, March 8th, from 8 a.m. to 12 p.m. at our Texas Children's Pediatrics Westwood location, we will be offering the MMR vaccine if you have not had your first dose and are over the age of 12 months of age. This will continue next Saturday, March 15th, again from 8 a.m. to 12 p.m. at the TCP Westwood location. We're also going to provide vaccinations through our mobile health clinics, and you can find the location of our mobile health vans online, and we will be able to have you also make an appointment to set up that MMR vaccine online as well. This is the time, as everyone here has said, not to panic. This is the time to prepare, and it's to boost prevention in the community. That is how we're going to effectively protect our children and our families. Texas Children's is here. We will offer the vital help and resources, especially to those in need. And for children out there, please be reassured, your pediatricians want to hear from you. This is what we live for, is protecting kids. Thank you.
Thank you. We'll now hear from Dr. Tamisha Jones, Interim Chief Medical Officer at Legacy.
So at Legacy Community Health, we are proud to take care of Houston's community, regardless of the ability to pay, and measles and vaccination against measles is no exception. We've also heard the call to action as our friends at Texas Children's Hospital, and so we also will be holding an event this Saturday, March 8th, from 8 a.m. to 2:30 p.m. at 2 of our largest locations, one of which is in Southwest Houston. That is at 6441 High Star. Again, 8 o'clock a.m. till 2:30 p.m. The second location will be in our 5th Ward community, and that is at our Lions Clinic. That is at 3811 Lions Avenue. Same hours, 8 o'clock to 2:30 p.m. for children 12 months to 18 years old, especially those who are Medicaid, uninsured, underinsured. What we do at Legacy is we take care of our entire community, and we are happy to do so. You can reach out to us at our website, legacycommunityhealth.org, for more information on how to keep you, your children, and your family safe.
Thank you. Would anybody like to comment on the babies up to 12 months old?
I'd be happy to. So the concern for the children who cannot be vaccinated, which currently most children under 12 months of age are not able to receive the first vaccine. The under 6 months of age cannot get the MMR vaccine, and so our recommendations as pediatricians is avoiding large crowded places if you're unsure of who might be there, not coming in contact with somebody with a known measles exposure or known measles infection, and to delay international travel because there are cases arising from that travel to other places where there may be outbreaks. There are special circumstances for the 6 months to 11-month-year-olds, and if you go to the CDC website, they actually have those guidelines. But again, like I said, if you speak with your pediatrician, they'll be more than happy to walk you through whether your 6 to 11-month-old would qualify. 12 months and over, as long as there's no other underlying medical condition, you are ready to go. You can get your vaccine.
Okay, thank you. We'll take any questions.
There seems to be like a global trend of not vaccinating children, also to theories that say that the vaccines cause autism. How do you notice this trend at the local level, and also where are those low vaccination levels here, right, in Houston area?
Yeah, so obviously that claim is absolutely false. and vaccines prevent illness. But let me let Dr. Hotez here expand on that question.
Sure, thank you. I got involved with going up against some of the anti-vaccine groups because, as you point out, the original assertion was that vaccines, beginning with the MMR vaccine, leads to autism. And I got involved with it because I not only make vaccines, but my youngest daughter, Rachel, who's now an adult, has autism and intellectual disabilities. And I wound up writing a book called Vaccines Did Not Cause Rachel's Autism, which goes into the details showing not only massive evidence showing none of the assertions are correct. And one of the things the anti-vaccine groups do is they keep on moving the goalpost. So as soon as you debunk one of their assertions, they come up with something else. So the original assertion in 1998 was a false claim that the MMR vaccine causes autism. There were large cohorts. First of all, the paper was shown to be fraudulent and retracted. Second, there were large cohort studies to show that kids who get MMR vaccine are no more likely to acquire autism than kids who don't. And then they keep switching it up to thimerosal preservative, to spacing vaccines too close together, to alum vaccines, to HPV. It's all not the case. And the reason is very simple. Autism is a neurodevelopmental condition with autism genes. We've now identified more than 100 autism genes, all involved in early pregnancy. So there's not even any plausibility for that. But the other problem is it keeps on moving up again. There's a lot of propaganda around with things like health freedom, medical freedom, and we can go into that as well. Thank you.
Just last week, we were reporting that there were 2 cases of measles being investigated, quote unquote, in Houston. Just to be clear for the community, those cases didn't reveal that there were anybody sick. Am I right?
The test results were negative. They're not useful.
We have no active cases.
So including those that
Yes.
we
There's been no detection, and we're doing everything possible, wastewater, all the available tests have shown no active cases in Houston.
I think
Now, that doesn't mean that you don't take all the precautions, as everyone has repeated. You should be vaccinated, and if in doubt, get a vaccination.
Could you also provide any
So,
clarity on?
I just think the confusion stems from the fact that there were 2 cases earlier on, but there was no contagion from that, right? So there were some, but there are none right now active. Yeah. Yes.
That's not what he's asking.
Yeah,
That's not, yeah.
he
I
knows
just
it.
want to make sure that you clear that.
2 cases.
We were running 2 tests.
Okay.
Normally but those were the results of the tests were negative.
Right.
Thank you.
All right.
Okay, real clear.
Yeah.
No
No
cases have been found
They were
in
negative.
Houston, Texas. But we're taking all the precautions, as these excellent doctors have mentioned, and the judge.
Director Williams, could you provide any clarity as to why those 2 people on Friday were suspected to have measles?
No,
If you're not at the mic, they can't hear you, Director. Yeah.
No, not really. We run tests every day for a lot of things. We don't usually report out when we're actually running tests. That was actually a mistake. But the results of the tests that you're referring to were negative.
Director Williams, you mentioned the school districts and daycares you guys really want to focus on are the ones that have low vaccination rates. Can we discuss what is considered a low vaccination rate, and also are we able to talk about which districts we're looking at?
You want to do it?
I think below 95%.
Below 95% is a low vaccination rate. We're looking at schools that are in several independent school districts.
Are we able to say which ones specifically?
I don't have the information with me, but we know. Actually, we can look at the immunization registry and tell which schools have low vaccination rates.
And then, when it comes down to it, obviously there are a lot of discussions I know that go into putting the mobile vaccination clinics as well as the vaccination clinics in place. How are we making sure that they're equitably distributed into areas that not only have those low vaccination rates, but maybe for people who don't have their own vehicles to be able to get to them?
That, in fact, is our strategy. We look at where there is a low vaccination rate. But in this case, some of the neighborhoods where you might assume have low vaccination rates are not necessary. That's not necessarily the case. There are various reasons, where the folks behind me could explain to you, why some folks don't get vaccinated. And so we're just looking at the numbers, and we're going to follow the numbers regardless of the neighborhood.
Yo quiero hacer una pregunta en español rapidito, para tal vez que usted
See,
pueda-
no, I was just gonna say, I know it's getting warm in here, so if anybody needs water or to take a seat, Tammy can help. Yeah.
¿Qué hace el factor de la diseminación de información errónea que acaba de mencionar el médico? Aquellas personas que todavía piensan que lo que está en social media o lo que está en cualquier lugar que las vacunas esta vacuna en particular causa autismo. ¿Qué le puede decir a la comunidad de eso?
Bueno, acaba de hablar el doctor Jotes. You don't speak Spanish, Dr. Jotes.
Not for broadcast.
Acaba de hablar el doctor Jotes y él es experto en vacunas y encima de eso su hija tiene autismo. Entonces, él ha estudiado este tema, ha escrito libros y ha estado batallando este mito desde hace muchísimos años, desde los 90 realmente. Y el hecho es que estas vacunas son seguras, que no hay un vínculo con el autismo. De hecho, el autismo es algo que se desarrolla en el momento de gestación, antes de que el bebé nazca. Entonces, no hay, o sea, ni siquiera es posible que eso suceda. Y es aquellas personas que inventan estas teorías de conspiración siempre están cambiando lo que se están inventando, el mecanismo. Entonces, a veces dicen que es si las vacunas son administradas demasiado rápidamente, una dosis a la otra. A veces se trata de que si es la vacuna contra el sarampión o el HPV. O sea, hay todo tipo de invenciones. Lastimosamente, hay personas en la comunidad que son vulnerables a creer esas historias, pero la realidad es que el sarampión ha estado bajo control por décadas. Gracias a esta vacuna, hoy día estamos viendo ese brote de casos en el oeste de Texas y son personas que no se han vacunado. Entonces, invito a todos, por favor, que se vacunen. And Dr. Jotes, he was talking about the misinformation that is going on, so maybe you can add that in English as well.
Yeah, unfortunately, the disinformation machine is very strong right now, and it's especially strong here in Texas. We even have an anti-vaccine group that gets PAC money, Political Action Committee money, here in Texas, and that accounts for, unfortunately, for a steep rise in the number of parents, not so much in Harris County, but other parts of the state, requesting non-medical exemptions. And as a result, we're getting these pockets of low vaccination coverage in the state of Texas. So in Gaines County, where the measles outbreak began, that vaccination rate is under 90%. And measles is a great exploiter of low vaccination rates. The minute vaccination rates go down below 90%, often the first virus infection you see as a breakthrough is measles, because, as the judge and the mayor point out, it's so highly transmissible. So measles is kind of the canary in the coal mine of low vaccination rates, but others will follow. We could also see pertussis, whooping cough. We've had polio in the wastewater in New York. So the worry is that the vaccine ecosystem will start to erode or unravel, and this is why we try to at least hold the line with measles to prevent things from getting any worse.
Last
Thank you.
question, Daniela.
Yes, okay, so the CDC obviously today has already mentioned that they will be helping West Texas. Here locally, have you guys had any conversations with the CDC? And obviously you guys have mentioned and reiterated we have no cases currently in Houston or Harris County, but have those conversations been streamlined? Any of those conversations been happening?
I'll just mention one thing and then allow my department director and health authority to make any comments, and that is and the availability of vaccines. We have a well-oiled machine in terms of if anybody is running low on vaccines, we can request more from the state and then the federal government. So in that sense, that coordination remains very, very strong. I personally have not spoken to a CDC representative. I did during COVID, but obviously this is not at that level. So do you have anything to add, Director Barton or Dr. Brown? Yeah.
So, I'm sorry. So, we are in direct contact with the state because of the outbreak in the state of Texas. With regard to the CDC, we have not had direct contact with them, but as the judge said, vaccine is readily available for distribution throughout the state of Texas.
Thank you.
Okay, thank you so much.
There was one more thing, Dr. Singh.
Oh, go ahead. Yes.
Just wanted to your question about it being equitable, I just wanted to let everyone know that the vaccines that we'll be providing at the locations that we spoke of, the mobile health clinics as well as TCP Westwood, will be free. So this is one of those things, and I think the combination of resources that you're seeing here with all the different groups coming together are going to be reaching so many different communities across the city. So I think this is a good weekend to get out there and get vaccinated if you haven't already. So thank you.
All right, and we do have them all over the county. All right, thank you all so much. Thank you to the speakers. Yeah, thank you, Mayor. Yeah, thank you
job.
for making